Hey everyone, it's Sublike, and welcome back to the channel. Today, we're tackling a common but often uncomfortable health issue that affects millions, especially women: urinary tract infections, or UTIs. From anatomy to hormones, we'll uncover the factors that make these infections more frequent in women. Let's get started. Let's kick things off with a quick anatomy lesson. The first thing to understand about why women are more prone to UTIs is all about the urethra. In women, the urethra is significantly shorter than it is in men. A shorter urethra means a shorter distance for bacteria to travel from outside the body to the bladder, where they can multiply and cause an infection. Now, you might be wondering, where do these bacteria even come from? Well, the most common culprits are E. coli bacteria, which typically live in the intestines. They usually don't pose a threat while they're in their designated area, but if they get into the urinary tract, that's when problems arise. Our bodies have defense mechanisms to keep these bacteria in check. However, certain factors can disrupt this balance and increase the risk of infection. Knowing this is the first step in understanding how to prevent them. Let's talk about proximity, specifically the proximity of the urethra to the anus. In women, the urethra is located closer to the anus compared to men. The anus is home to a whole bunch of bacteria, including the infamous E. coli. Because of the close proximity, bacteria from the anal area can easily migrate to the urethral opening, especially during activities like wiping after using the toilet. If these bacteria make their way up the urethra and into the bladder, it can lead to an infection. Simple habits like wiping from front to back after using the toilet can significantly reduce the risk of transferring bacteria. Understanding this proximity issue empowers you to take preventive measures. Knowledge is power, and understanding your anatomy can help you stay one step ahead of those pesky UTIs. Let's talk about a topic that sometimes feels a little awkward to discuss, but it's crucial for understanding UTIs' sexual activity. During sexual intercourse, there's friction involved, and this friction can irritate the urethra and make it easier for bacteria to enter. Additionally, intercourse can also transfer bacteria from the vaginal area to the urethra. Now, this doesn't mean you have to abstain from sexual activity altogether to prevent UTIs. Urinating before and after intercourse can help flush out any bacteria that may have entered the urethra. Staying well hydrated by drinking plenty of water is always a good idea, as it helps dilute urine and flush out bacteria. Communication is also key. If you're prone to UTIs, talk to your partner about it. Open communication can help you both understand the risks and take necessary precautions to minimize them. As women, our bodies go through various hormonal changes throughout our lives, and these changes can impact our risk of developing UTIs. One of the most significant hormonal shifts occurs during menopause. During menopause, estrogen levels decline, and this decline can affect the urinary tract in several ways. Estrogen plays a role in maintaining the thickness and elasticity of the vaginal tissue and the lining of the urethra. When estrogen levels drop, these tissues can become thinner and drier, making them more susceptible to irritation and inflammation. If you're experiencing vaginal dryness or discomfort, talk to your doctor. They may recommend over-the-counter lubricants or vaginal estrogen creams to help alleviate these symptoms and reduce the risk of UTIs. With the right knowledge and support, you can navigate these changes and maintain your urinary health. Let's delve into the relationship between certain types of contraceptives and the risk of UTIs. Some contraceptives, like diaphragms and spermicidal agents, can increase the risk of UTIs in some women. Diaphragms can sometimes irritate the urethra and make it easier for bacteria to enter. Spermicides can also disrupt the natural balance of bacteria in the vagina, making it more conducive to the growth of harmful bacteria that can cause UTIs. If you're using diaphragms or spermicides and experiencing recurrent UTIs, talk to your doctor. They can help you explore alternative contraceptive options that might be a better fit for you. It's all about finding the contraceptive method that suits your individual needs and minimizes any potential side effects. That's it for today's video on UTIs in women. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips and information. Stay healthy and take care.